In this video, I'm going to talk about some of the different massage techniques, including their mechanical, neurological, physiological, and even psychological benefits. The first type of massage is effleurage. This type of massage starts with light pressure and builds to deeper pressure while moving in a smooth, rhythmical, and relaxed manner. It uses the wide surfaces of your hands, and the pressure and strokes are directed towards the heart to encourage venous return. It's also good for relaxing muscles, reducing pain, and relaxing the patient. Next type of massage is petrissage. It involves lifting and kneading the skin. It stretches and separates muscle fibers and fascia from the skin and scar tissue, and it is performed by squeezing, picking up, shaking, rolling, or wringing the tissue. It helps force blood out of an area by applying and releasing pressure, and it frees adhesions by stretching and separating muscle fibers, fascia, and scar tissue. It is also useful for mobilizing deeper tissues to improve muscle circulation and relaxation. It is performed by keeping the fingers together and flex at the MCP joint to lift and knead the tissue. Friction massage is performed by using the finger or thumb pads or elbow to move in small areas. It is applied in small cross-section or circular motions used for mobilizing specific tissues. Deep pressure is applied to affect the muscle by mobilizing and separating the tissue to break up any scar tissue. Reverse friction massage is especially helpful in treating trigger points, tendinitis, post-surgical scars, or joint adhesions. Active assistive is a combination of compression with broadening and muscle stripping techniques. It is performed by tacking down one area of tissue and using the wide parts of your other hand to pull away from that area. This helps to strengthen and lengthen the affected muscles while increasing range of motion and decreasing any restrictions in the area. Ischemic compression is a neuromuscular technique that involves applying direct pressure to a trigger point with the thumb, fingertips, or elbow. It works to decrease hypersensitivity and hypertonicity in taut muscle bands. Direct pressure is applied to the area for about 30 to 90 seconds or until the pain decreases for the patient. The amount of pressure applied is determined by the patient's pain tolerance and should not exceed a 7 or an 8. This is a fairly painful process and the patient should be aware of it. This should not be used as a technique on acute injuries. Tappettement is percussion of tissue or tapping of tissue in a rhythmic manner. This was performed with cupped hands and relaxed wrists by alternating the hands to create a gentle slapping motion. This is useful for increasing blood flow or releasing lymph or fluid in mucus blockages, as well as stimulating afferent nerves. It promotes relaxation in the patient and can desensitize the skin's nerve endings. The next type of massage is vibration. It is essentially rapid shaking. Vibration uses varying pressures in areas of your hand, and it works to increase blood flow and provides systemic invigoration of tissues. One of the types of massages not videoed is called sports massage. It's a broad term that's used to describe a combination of effleurage, petrissage, and friction massage. It's used for balancing muscle groups, shortening recovery time, and increasing functional range of motion in preparation for athletic activity or following athletic activity typically. Similar to sports massage, myofascial release involves the combination of traditional effleurage, petrissage, and friction massage strokes with simultaneous stretching of the muscles and fascia to obtain relaxation of tense or adhered tissues and to restore tissue mobility. This technique should be slow and at a moderate intensity to elongate the fascia.